Hello and welcome to our latest webinar with equine reproduction specialist Jonathan Pycock. Today's webinar will be on twin detection, management and how to avoid missing twins in the mare. As this is a pre-recorded webinar, any questions you have for John can be submitted to hello@imv-imaging.com. I would now like to hand over to John to begin his presentation.
Greetings, everybody, to the next in the series of webinars on equine reproduction. And this webinar is going to be about twin detection, the management, and how to avoid, as best we can, missing twin pregnancies in the mare. We'll talk a little bit to set the scene about early pregnancy diagnosis, but it won't be in any great detail, and those of you who want to can refer back to a previous webinar we've done on the subject and take a look at it in more detail there. So I'm just going to set the scene a little bit on early pregnancy diagnosis and try and relate it how it fits into detection, management and how to avoid twin pregnancies. What is the best time to perform the first scan for pregnancy? You can have a think about this. We can't actually collate everybody's votes, but if you're watching this, you can have a think to yourself. When do you, and there may or may not be a right answer, but when is the best time to perform the first pregnancy scan in the mare? 12 to 13 days from ovulation, 14 to 15 days from ovulation, 17 to 18 days from ovulation, or 15 to 16 days from covering or insemination. Now, the four options, you'll note option 4 is a little bit different. It's a time from covering or insemination, which I appreciate may be how some of you have to work out the timing of your first pregnancy scan. That, of course, introduces a variable because the key factor, of course, is when the mare ovulates. So I was fortunate in that most of the time I'm working at stud farms or with mares where I've monitored them for ovulation, so I know exactly the number of days from ovulation. So my pick, and I'm sure for most of you, would be 14 to 15 days from a detected ovulation. And wherever I was when I posed this question last, you can see that 50% of the group went for 14 to 15 days from ovulation. The 18% who went for 15 to 16 days from covering or insemination, well, that's the best guesstimate we have of the mare being 14 to 15 days from ovulation. But it's important to note that it is a guesstimate. So wherever possible, when we're doing an early pregnancy scan, it's much preferable for us if we can do it based on a known ovulation date, but I accept that's not always possible. So where we can, we'll do that first pregnancy scan at 14 to 15 days from ovulation, as per the little smiley face there. And we do it at that time because the pregnancy is readily visible on ultrasound. Here's a 14-day scan, and you can see that that Conceptus is going to be around about 12, 14 millimeters in size, easily detectable. What you have to remember is the pregnancy is highly mobile at this stage, and this is very relevant to twin management. And because it may be found in either uterine horn or the uterine body, it's very, very important that the entire uterus is examined thoroughly at your early pregnancy diagnosis. And we've got a couple of video clips as we move through the presentation, which will come back to make this point quite visually for you. So do remember that when you're doing this early pregnancy scan, don't rush the examination. Do it very thoroughly and systematically, and make sure, as well as examining carefully the left and right uterine horn, you also examine the body of the uterus, because 14 to 15 days after ovulation, that early Conceptus may be in the body of the uterus. And one of the key features we need to understand if we're dealing with the best approach to detecting, managing and avoiding missing twins is to understand what fixation is. Now, fixation has a definition. It's defined as the cessation of Conceptus motility. Put a simpler way, it's when the little black Conceptus you can see on the ultrasound screen stops moving around. We tend to say it occurs on day 16. So from day 16 after ovulation onwards, that early Conceptus stops moving. Of course, as with anything involving a natural event, it's got a degree of variability in it. But as an industry and a discipline, we tend to accept that fixation begins from day 16 onwards. So how is that relevant? Well, that means that from day 16 onwards, the Conceptus is going to be fixed. It's going to be held in place and stop moving around the uterus of the mare. So, of course, if we're dealing with twins, the two Conceptuses can be fixed together or they can be fixed apart, because fixation normally occurs at the flexure, that's just the bottom part, illustrated by those arrows, of the base of either the left or the right uterine horn. And if both Conceptuses are in either the left horn or the right horn, that's termed unilateral fixation. If one is at the base of the left horn and one Conceptus at the base of the right horn, then obviously enough, that is termed bilateral fixation. Just occasionally we may get fixation in other parts of the horn or body, but that's not the normal. So we're going to park that for now and restrict our discussion to the normal situation where fixation occurs at the base of the left or the base of the right horn, and either unilateral or bilateral. When do we do our second and third pregnancy scans? Well, in most practices, the second scan will be done around about 25 days after ovulation to check that pregnancy is developing normally, and do a little check for us that we definitely have no twin pregnancies present. And we'll usually put in a third scan around about day 34. We'll come on to the significance of day 34 in a while when we talk about management of twins. However, of course, the timings are arbitrary, so it doesn't matter if in your practice you tend to do the second scan at 21 days, 26 days, whatever, and you may not even get an opportunity to do a third scan. So these aren't fixed timings that you have to do. They happen to be the timings we do in our practice, but they are somewhat arbitrary. You may need to do more scans, for example, if the mare has many cysts, or you're dealing with a mare that in the past has undergone early pregnancy failure. You may wish to keep a closer eye on the pregnancy by doing an increased number of pregnancy scans. As ever, in many of the situations we work with in equine reproduction, economics may be the ultimate deciding factor. And if you've got mares that are being covered by stallions at a relatively low fee, well, the owner may not be happy if you scan the mare more than once or twice. So, as ever, economics can affect this decision-making process. However, if you only perform one ultrasound scan for pregnancy, we believe it's important the owner should be notified this is against veterinary advice and given a warning that it will increase the risk of missing, if you will, or not detecting a twin. And it's always best to record this in the mare record or the clinical notes, because as the veterinarian, it's our role to advise the owner that a second scan for early pregnancy should always be performed. And if they decline that and only have you do one pregnancy scan, it must be clearly recorded that that is against veterinary advice. In the role I work in these days at the Veterinary Defence Society, those of you in the UK and Ireland will know that this provides indemnity insurance to veterinary surgeons, and one of the commonest claims we have involving equine reproduction is where a twin pregnancy has not been detected. So these things do happen, they do slip through the net, and one of the main causes of that is where only one scan has been performed. And in that situation, it's very helpful for us if there's clear and definite evidence that the veterinary surgeon advised a second scan and that was declined by the owner. Why don't we like twins? We know it's undesirable. Well, in simple terms, it's because, unfortunately, abortion is by far the usual outcome. Generally, this occurs late in gestation, typically around 7 to 8 months. I don't want to get into placentation of the mare, but basically that the mare needs all the twin, or the developing pregnancy, I should say, needs all the placenta, the uterus that's available. And if you've got two in there, well, one of them is generally not going to have enough uterus for the placenta to attach to take it through to term. So this picture you can see is the typical abortion with a twin pregnancy. One of the twins has developed normally through to 7-8 months. The other was always developing small because it was only in one of the horns rather than in the horn and the uterine body. And that co-twin will die around 7 to 8 months. And then because of the nature of parturition in the mare will go on to abort both of them. So that's a typical pattern we get for abortion in a case of twins. 7 to 8 months after the pregnancy has been detected, one of the co-twins being essentially normal and one of them being very small. And as you can imagine, that's pretty distressing for the mare and the owner. And something that isn't always appreciated is because both horns of the uterus have been stretched by accommodating the twin pregnancy, the mare becomes difficult to get in foal again that same year in which she aborts, because mares generally conceive in the uterine horn, which they were not pregnant in the year before. So put another way, in a normal singleton pregnancy, it develops in the left uterine horn and the uterine body. In that season after foaling, such a mare will develop the next pregnancy in the right uterine horn and the body. So if both uterine horns are stretched, that presents a difficulty in getting the mare back in foal in the same year in which she aborts. Certainly within 6 to 8 weeks of the abortion. After that, it may be possible, but it can be difficult to get the mare back in foal again quickly. And especially if that mare is aborted, perhaps at around 7 to 8 months, which may be relatively early in the breeding season, it then becomes frustrating for owners when the mare won't go back in foal that breeding season. It also presents a problem in a dystocia aspect for the mare as well. So all in all, it's not a good situation and distressing for both mare and owner, and veterinarian, of course, if you have to deal with it. So I don't want to go too much into placentation, but that's really summarizes what we talked about. If twins develop, there is an insufficient area of uterus for the placenta to attach to. And there you can see one fetus becoming larger than the other. The smaller one will die, and both tend to be aborted 7 to 8 months of pregnancy. Just occasionally, twins will be carried to term, perhaps where the uterine body has split in two, and one pregnancy is in the left horn and half of the uterine body, the placenta, and in the other pregnancy, it's in the right uterine horn and half of the uterine body. In that case, both may survive, but even if one survives, they're generally both small, and there are exceptions, so of course, but rarely will they perform well as athletes. And it means that carrying a twin pregnancy is dangerous for the mare, as it can cause a dystocia. I put these points in because just occasionally, and it's a not unreasonable point, but a mare owner will say to you, well, Doc, do you think I can just let the mare carry on with these twins? And I'm not very comfortable about dealing with one of them by eliminating one of them. And I think we can justify that elimination approach by illustrating some of these points, that in most cases, this is going to end up in an abortion. So we're going to lose both of them. And if they happen to be carried to term, apart from the fact they're both going to be small and often run into joint problems, etc., it's in fact dangerous for the mare as well. So I think all things told, it gives us, if we felt we needed it, a justification to try and deal with twin pregnancies, which we'll talk about in a moment. As I'm sure most of you know, twin pregnancies arise when more than one follicle ruptures at ovulation with oocyte release. And that's why it's so important at the early pregnancy scan in checking for number of corpora lutea. I put in brackets there almost because there are reports following embryo transfer of a single embryo where a mare will develop a twin pregnancy. So I put almost in, and I don't want to get too much into why that happens, but we think that only occurs when some form of artificial breeding technique is used. So let's assume for our purposes that twin pregnancies arise from more than one follicle rupturing at ovulation with oocyte release. So commonly it'll be 2 follicles, but of course we occasionally see triplets in the mare, and in that situation, of course, 3 follicles will have ovulated. But in most cases, it's 2 follicles ovulating, and that's, you know, twins are not uncommon. Figures for the thoroughbred would suggest maybe as many as 35 to 40% of ovulations are in fact a multiple ovulation. So it's a very, very common occurrence, which is why it's important for us as veterinarians that we're able to deal effectively with a twin pregnancy in terms of detection and subsequent management, because this is not rare. This is very, very common. Warm blood, slightly less incidence than the thoroughbred, and pony mares generally have a much reduced incidence of twin ovulation. Of course, a twin ovulation does not equate to twins. It doesn't equate to the mare being pregnant at all, simply because we don't know both oocytes will be fertilized. We don't know either oocyte will be fertilized. So it doesn't mean because you detect a twin ovulation, you'll necessarily have a twin pregnancy, but it should be your red flag sign for looking out for it. And this would be a scan of a mare at 14 to 15 days, the first pregnancy scan, and there you can see a twin pregnancy. On the left, there is a slightly bigger conceptus than on the right. Mistakenly, some people believe that's indicative of early pregnancy failure by the conceptus on the right. Whilst that can be the case, in the vast majority of situations, it simply means there was a degree of asynchronicity to the ovulations. By asynchronicity, I mean that one ovulation occurred a number of hours after the other. The early conceptus grows at 2, 3, 4 millimeters a day. So you would only need the second ovulation to be, say, 24 hours after the first. And this is the picture you would obtain at the first pregnancy scan. It is not indicative of that pregnancy on the right being small and therefore likely to fail. It simply has occurred from an ovulation 24 hours after the ovulation which led to the conceptus on the left. Now let's have a look at a video of an early pregnancy scan, and like all the videos I tend to show at meetings, I don't edit these. I take these just as I've come across them in the field. So you'll see my routine. I'm going up onto the left ovary, which is what I do first always, and there you can see 1 cl, 2 cls. If you want to go back later and look at this over and again, you can do, because I appreciate it may be quite quick for some of you who aren't used to scanning mares as quickly as perhaps I am. So left ovary, I saw 2 cls. Now I'm going down the left uterine horn and I'm looking at structures there. There I'm looking at a structure. What do you think we've seen so far? I think we've seen a mare with several cysts and no CL on the right ovary, by the way, there, just to interrupt. A mare with several cysts and 1 15-day conceptus. But I've got a mare with 2 CLs, so boy, I better look carefully here. Oh, it's tricky though. Lots of cysts in there. I guess because I've over the years got a degree of experience, I can tell all those are cysts because they're not regular and they don't have that perfectly spherical shape. But if you're in any doubt, schedule an examination in 2 or 3 days' time. Don't worry about that. So cysts are very, very important to record, and our system, as if you go back to the earlier webinars on follicle evaluation, I'll run through the record sheet we use to record our findings in mares. We always make a note of the presence of any endometrial cysts, particularly those that are likely to confuse us with the early pregnancy. So it's a very good idea to map those out before breeding and record them on your mare record chart, whatever that may be. So that's a little bit about detection of twins. What's their treatment or management? Well, assuming the mare can be scanned at 15 days from ovulation, one pregnancy can be massaged away from the other using gentle pressure from the transducer of the ultrasound machine. You can use your fingers to do it, but that involves, of course, you withdrawing the transducer and, as it were, going blind in a sense and manipulating one of the conceptuses to the tip of the horn and crushing it. And all the veterinarians, I was just thinking there for a moment, but all the veterinarians in our practice and having done this talk many times on many parts of the world, from my experience talking to the delegates there, most of you will use the transducer, and I think that's by far and away the commonest, and I think, of course, the best way of doing it rather than using your fingers. I've put there a 95% success rate. I think, in fact, it's higher than that. For most of us who've got reasonably adept at this technique and are able to scan at 15 days, we generally find crushing a twin in most cases relatively easy, and probably we could push that success rate much nearer 100% in terms of ability to crush one. Doesn't mean they'll all go on to carry through to term, of course, because embryonic loss may occur with them, but nothing to do with your physical crushing of one of the conceptuses. Once you've moved them apart, because that's the aim, you put that transducer, as I've shown with that big block arrow there, in between the two conceptuses, and you then will rotate your wrist with an attempt to move the conceptuses apart. What I like to do is take one of the conceptuses, the one I've selected that's going to get crushed, generally the smaller one if there is a size difference, up to the tip of either the left or the uterine horn, and I'm just behind it all the time, and it runs out of space and then gets crushed. The advantage of taking it up to the tip of the horn is twofold. A, it runs out of space to be pushed away from, so that causes its rupture. And B, the inevitable fluid that occurs when it's ruptured is less likely to run down and disrupt the remaining conceptus. So if you can get them as far apart as possible, that's better. And I generally only need a light pressure to disrupt them, as long as they're 14 to 15 days. There's a much greater pressure needed to rupture a 12, 13 day conceptus if you happen to detect them, and that can be potentially problematical for you. If you aren't very experienced and you detect a 13-day conceptus and a 15-day, then you may want to come back a day or so later. I wouldn't leave it much past a day or two, and you then may find that younger conceptus, the 13-day one, is then 15 days and easier to crush. Of course, the downside is you may then find they're unilaterally fixed together, and you'll have to go through the process of moving them apart. So like everything, it's a little bit of swings and roundabouts, and it's probably better to work on your technique to get able to crush 13 and 14-day conceptuses. If we look at a video of the process, it doesn't always lend itself particularly well on a video clip, but here's one of a 15-day conceptus, first pregnancy scan, and always the same system for me. I've nipped up onto the left ovary there, saw CL down the horn, little cyst there, base of the right horn, it would look to me, and pingo. There's that flicking approach, that dumbbell approach, people call it, like the old-fashioned weightlifting devices, and you get that flick of them. And yeah, I've just paused there. Yeah, you've got two CLs on that right ovary. You don't always have the CLs on the same ovary, of course, but you happen to in this one. Two CLs on the right ovary, twin conceptus, So I'm now putting pressure on them. You can see it flattening across the top. Now I've gone back to look at the one I'm leaving. Now I'm moving this one up to the tip of the horn. And then I've crushed it. You see a little bit of fluid there. Go back to check the one I've left. Looks okay. A little bit of fluid running down. Of course it will. It's run by gravity. And, you know, even at 14, 15 days, a not insignificant amount of fluid. And the further you can get the Conceptus you're going to crush away from the Conceptus you're going to leave, of course, the better. This is a video clip from a good friend of mine, Angus McKinnon. Yeah, it's not one of mine. You can tell because poor old Angus has his hairy arm hand on it, and he's trying to show. But it's a good video, so I don't want to be rude about my chum. But there you can see him showing what you do, and he makes that dramatic crushing effect. I don't know if we can look at that again, but I'll play it again. I'm not convinced you have to do that myself, but it's a nice video clip showing the external version of what we showed you in the video, moving it up to the tip of the horn. Then it sort of just runs out of space, and generally I find they'll just pop from that. I don't often find it necessary to do that sort of flicking motion, but hopefully that's of some use for you. I'll put this in here because what drugs are given after a twin crush? And there's quite a few. I think I've got most of them here. Progesterone, altrenogests, non-steroidals, non or antibiotics. Well, what I do is non, number 3, which a third of the people went to here. Now, it doesn't mean I'm right. I generally think I am, but it doesn't always mean I'm right. So if you like to give progesterone after a twin crush, or you like to give phenidine or any other non-steroidal, then you carry on doing that. But to answer it honestly, I don't. I'll just won't give the mare any drugs at all. Twin fixation. Let's just check we know what we mean by bilateral and unilateral. So here we've got unilateral fixation in the left uterine horn. Here we've got a bilateral fixation. And what we know, it's 62-38, I think in my experience, it's nearer 70%. So the vast majority of twins will fixate unilaterally. So what does that mean? Well, it means, folks, you're going to be much easier to move these Conceptuses apart and crush one of them if you scan the mare before day 16. After day 16, these are pretty much fixed together. We'll talk about our options in the next slides, but if you can, that's why it's important to get your pregnancy scan in at day 14 or day 15. So we've talked about twin crush and what we do if we can get the mare at day 14 or 15. What if, for whatever reason, we're not able to ultrasound that mare for pregnancy until after fixation? Let's put after day 17. It's a little bit variable, but let's go with day 17 onwards, because in the vast majority of cases, those twin pregnancies will have fixed. And because of studying this, we know that the vast majority fix in a unilateral mode, either at the base of the left horn together or the base of the right horn together. Only around about a third or less will fix bilaterally with one in the left horn and one in the right horn. And that obviously has significance in the ability to crush them, because if they are in separate horns, it still remains easy enough to crush one after day 17. If they are fixed unilaterally, as the vast majority are, well, you're going to have problems. So that is why I'm stressing this value of scanning mares around day 14 or 15. The other physiological feature of pregnancy we need to bear in mind in our management of twins is the formation of equine chorionic gonadotrophin. Once ECG has begun to be formed and produced by the endometrial cups you can see here in this image, well, that effectively prevents the mare having a fertile estrus period, because she won't ovulate properly for effectively 2-3 months. So particularly say with a thoroughbred for the rest of the breeding season. We've been altering our mind about when ECG has formed in the mare. Years ago, we used to say it was after day 36. Then it sort of slowly over the years crept down. And I think some mares will be positive for ECG as early as day 32, day 33. So that's why whatever we're going to do with twins, we really have to make a definite decision by day 30, day 31, because if we leave the twins after that, the option of starting again will disappear from our armory because the mare won't have a fertile estrus period again because of formation of endometrial cups, which produce chorionic gonadotrophin. So let's have a look for, first of all, let's start with unilateral twins. We'll talk about bilateral next. Let's start with unilateral twins because this is what the vast majority will be. So you've come to your mare after day 17 and you've detected unilateral twins. So well done for detecting them. But now what are we going to do? Well, you can try and crush one. You could leave and monitor them. You could leave and monitor them until day 30. You could give prostaglandin straight away. There may be other options, but let's work with these four. Have a think which of these four would you try and do. And there may not be a right, there may not be a wrong. Well, wherever I was when I asked this, the majority of you went for trying to crush one. And I think that's what I would do. I always have a little go at day 17 to try and move them apart and nibble in on one of the Conceptuses and crush it and just hope the fluid that inevitably is going to surround it, because you haven't been able to move them very far apart, will be only transitory and the remaining Conceptus will survive. Obviously, once you get much past day 18, 19, this is a law of diminishing return, shall we say, and it really becomes very, very difficult to do without damaging both twins. So leave and monitor becomes a perfectly reasonable option. Probably not beyond day 30 because of what we talked about in the previous slide, the formation of chorionic gonadotrophin. So leave and monitor until day 30 would be a reasonable approach. Make your mind up at day 30. If you've still got both, may well give prostaglandin. We'll talk about some of the other techniques we can do for late twin management towards the end of the session. But you may decide to leave and monitor them until day 30. If you've still got two with two good heartbeats, give one of them or give the mare prostaglandin. Some of you may decide at day 17 to give prostaglandin straight away. And yeah, I don't know. I'm surprised nobody went for that approach wherever I was. It's not an entirely unreasonable approach. But as I say, I would probably have a little go at trying to crush one. If I couldn't do that, I would just keep an eye on the mare, but I wouldn't let it get past beyond day 30 before I'd be giving her some prostaglandin. So do nothing and monitor is a option. When reduction occurs with unilateral fixation, it generally occurs prior to detection of both embryos, which will be around about day 22, 23. So if you've got two healthy heartbeats past day 23, day 24, well, the chance of unilateral fixation is slim. So you may want to consider giving prostaglandin and starting again. If it's only day 17 or day 18, then you may have a go at attempting a reduction via the same technique as at 14, 15 days, trying to move them apart. If they won't move apart, just try and nibble in, as it were, on the side of one of them and crush it. But you're going to have an increased risk of failure because of your inability, not your inability, just the fact that they are unable to be moved apart. Okay, so that's unilateral. Less common will be bilateral twin conceptuses, where we've got the pregnancy at the base of the left or the base of the right horn. So what options can we have there? Crush one up to day 25, crush one up to day 30, crush one up to day 35, prostaglandin immediately, or monitor for natural reduction. Well, what I for is what most people went for here. Up to day 30, I would crush one of them. Why I don't like doing it day after day 30 is really twofold, and we'll talk about that in the next slide. But that is what I would go for, crushing one up to day 30. A number of people went for crushing one up to day 35. Nobody went for prostaglandin immediately, which I think is correct. Why would you have a go at crushing one? And a number of you went for monitor for natural reduction, which again is fair enough. But I think in bilateral twins, they aren't fixed together. So as soon as you detect them, get in there and crush one of them. To some extent, they're actually quite good ones to practice crushing a twin on, because they're well separated and they're fixed in place, so they're not going to move around all over. So it's good for you if you haven't crushed a twin before, if you've got a bilateral twin, to get used to what the feeling is when one of these twins pops, as it were. So what I do is I'll eliminate one of the twins immediately upon detection up until day 30. Crush one after day 30. Well, I'm not actually saying I wouldn't have a go, but the difficulty is once you've gone past day 30, the likelihood of the remaining pregnancy surviving is much less, because you just have so much fluid from crushing that pregnancy above day 30 that it'll run round onto the other one and disrupt the membranes. The other feeling is you need an increasing amount of force as the pregnancy gets up to day 30 and beyond. And I think there's a risk of damaging the mare. So I sometimes will have a go at crushing twins after day 30 if they're bilateral, but I'll caution the owner of the two problems, that we're highly likely to lose the remaining pregnancy, and there is a small risk of damaging the mare, because you may need quite a degree of force to manually rupture the pregnancy after day 30. So what other options have we got after day 30? Well, the two techniques, transvaginal ultrasound guided aspiration and craniocervical dislocation. Before we go on to talk about these, I want to make it clear that these are the techniques we use when, for whatever reason, we have gone beyond being able to crush them by a relatively simple technique at day 14 or day 15. There might be many reasons. Maybe you didn't detect them. Maybe the mare wasn't presented for a scan until beyond that day 17 period. But I don't want, although I'm going to talk about these two techniques at the bottom, please don't think these are how we deal with twins. These are, I don't know whether salvage techniques are the word, but these are the techniques we use when, and it does happen relatively frequently, we get presented with a twin pregnancy beyond the stage at which we can successfully manually crush one. So I have a particular interest in this approach, using a transvaginal ultrasound guided needle puncture. For many years, I was involved in oocyte recovery of mares, getting oocytes out of follicles of mares, and it struck us that well, if we can direct this needle into a follicle to try and aspirate an oocyte, maybe we can direct that needle into one of the twin pregnancies. So we worked away on this technique, and we use a different scanner to what we normally use. We don't use a linear array scanner. We generally use a sector scanner where the beam projects out from the end of the ultrasound, and here you can see how it looks. You can see this would be a pregnancy, I don't know, 45 days maybe, and you can see the broken, or the dots indicate the direction of the needle when I push it through, and you can just about see that needle tip there where I've directed it into that 44 day Conceptus. You'll notice here, you can see this metallic coating on the needles. They allow us to image. They're particularly echogenic, so this would be equating to this coating on the needle. So you've got to remember the actual needle tip itself is slightly beyond what you can see on that ultrasound machine. Just to show you a video of it, here you can see us. This is a mare. I don't quite know. I can't remember now how many days exactly she was. Looking at that, I'd say she'd be 55 days around about. And here you can see I'm pushing that needle into the mare. You can just see it. We haven't got the needle guide on this for some reason. You can see I'm pushing it through. This is the this will be the needle tip. This is the fetus which I'm going to contact the needle with. So it's a much more involved technique. These pregnancies are quite difficult to manipulate, and I was just trying to bring I mean, apologies, it's slightly macabre, but as I said, A, it's a salvage technique, and B, we don't want to let the mare go through carrying the pregnancy to term. There you can see we've just been putting that needle into the heart of, if we can, one of the pregnancies. Now, if you think that's a slightly gruesome technique, this is possibly even more so. Craniocervical dislocation. Colleagues do talk about doing it per rectum. I didn't get involved in it at all, really, in our practice, but Jimmy Crabtree does a few, and very quickly James found that rectally is very, I don't know whether difficult's a word, just didn't seem to work very well. So I think almost universally now, if he does one, he does it via a laparotomy incision. And the idea, to put it in basic terms, is dislocation of the head from the neck of one fetus. And I believe Karen Wolfsdorf was the first to describe the technique back in 2006. So as I say, James uses a flank approach, standing sedation of the mare, flank incision, goes in to locate the conceptus that's going to be, or pregnancy, that's going to undergo the CCD, and you sort of just, I can't really put it any other way than flicking the head off the fetus. So a little bit of a gruesome sort of technique. Here you can see this is the heart does beat for a considerable time after the head has been removed from the fetus, so it does create a little bit of a gruesome video. But I want to stress to you, this is a situation that you shouldn't be in. But for whatever reason, you may find yourself in it with a twin which you don't come across until a relatively late stage of gestation. And this can be one of the options you can talk through with the owner. So you've got to know that there are these options out there, but they're very much the exception rather than the rule to our approach to twins. Now, I want to leave you with this video clip because this encapsulates a lot of what we've been talking about. And I may just sit and let you watch it first off. Remember my routine. We've gone up now at the left ovary. Lots of 2.5, 3 centimeter follicles. Down the left horn, base of the left horn, uterine body going up the right horn now. Oh, there we go, look. Bingo. 15-day conceptus. Nice look at it, can only see one, looks okay, smooth shape. Going up onto the right ovary. What have we got on the right ovary? Everybody seen? Give you another clue just in case you missed it the first time. 2 CLs, folks. Well, I better go back, have another look at this thing. Whoa. Well, beats me. I can only see one. Come out quickly, scanning the uterine body on the way out. Cross, across, 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 across. Almost out. What have we got there? Cyst. Bit small for a pregnancy, isn't it? No, it's not small for a pregnancy. It arose from an ovulation probably 3 days after the one that led to the 15-day Conceptus. So whenever I saw these and detected them in a season, it always reminded me that, boy, we've got to be so careful when we're doing this first pregnancy scan. Don't forget the uterine body, and don't forget ovulations can be 3-4 days apart. Now, you're not going to get this situation with a frozen semen insemination. I wouldn't have thought. Why can I say that? Have a think. Why wouldn't you get this situation with a frozen semen insemination? Well, you know, you've got to estimate what the difference in size is between those Conceptuses, and you know, I think there's at least 3 days size difference between them. I suspect the one in the uterine body was a day 12, day 11, day 12 Conceptus, and we've got a day 15 Conceptus in the uterine, you know, the base of the right horn, I think it is, whatever, base of left or right, doesn't matter. So I think you've got a 3-day size difference. So it means the sperm that it either inseminated the mare or at natural covering has hung around until that second ovulation 3 days after the first. Now, natural covering, standing from semen from the vast majority of stallions will last 2, 3, 4 days. So particularly if you've got natural covering situation or fresh semen insemination, you've got to watch for these ovulations more than 3 or 4 days apart, because you still can get fertilization of the later ovulation. And if you're not very, very, very careful in your examination, you may miss that second pregnancy there. Now, your other way, if you didn't see that 8-9 millimeter Conceptus in the uterine body, but you had detected 2 ovulations, you've got 2 CLs there, and that one 15-16 day Conceptus, well, you may say to your client, look, I can only see 1 pregnancy here, but just in case these ovulations occurred 48, 72 hours apart, I'm going to come back in 3 or 4 days and do a follow-up scan. So that in this situation, you may decide to deviate from the normal system of your second scan being 22 to 25 days afterwards, and looking for that second pregnancy. So all the things which you can do, and that's very, very important to do so. So it's just, I like this video because it's a salient warning to me of what can happen if you aren't very, very careful. So it's worth you going back and having another look at that video. It's a really nice video clip, I think. These 2 Conceptuses, 3-4 days apart, and highlighting the difficulty of looking, or the importance, I suppose I should say, of looking very, very carefully. And if you see 2 CLs and don't detect twins, it's not unreasonable to say, look, I'd like to come back and check this mare in a couple of days just to make sure that there's only 1 Conceptus developing. Okay, well, that's all. That's a session on twin detection and management, and by following the things we've talked about, hopefully minimizing the risk of you failing to detect a twin pregnancy and all the problems that ensue from a mare going on to abort twins. So thank you very much for your attention.
Thank you, John. Any questions that you have for John can be submitted to hello@imv-imaging.com. You will receive an email in the coming days with the full recording of the webinar. You can find previous webinars we have done on our website. Thank you for joining us. Goodbye.